big hope because sometimes I believe that, especially in the beginning of the live stream, the video tends to be really lagging. It all boils down to poor internet connectivity, and I hope I'm visible and audible at this time. I recently uploaded a live stream. The beginning, I believe 10 minutes of it is a bit laggy, but if you can watch it beyond 10 minutes, then you will really like the video because I have shared on this channel. So in this live stream, I would like to talk more about the other videos I uploaded on YouTube. I have uploaded more than 150, and my aim is to get through as many as possible. I just want to talk about them to give you a bit of context regarding the kinds of videos I have uploaded on YouTube, and maybe you will enjoy hearing about what was going through my mind when I was making these videos and what I was trying to convey. Again, if you have any questions, you can always ask and I'll try to reply to them as soon as I encounter anything that you want to ask me. So the last video I talked about in the previous live stream was video number 30, and I have the pictures of the videos on my phone, so I'll be looking away from the screen sometimes. The last thing I talked about was things you should not do in London, and video number 31 was on history. This is basically how to obtain history in MRCS ENT OSCE, because in MRCS ENT OSCE your ability to obtain history is also monitored. So you might be presented with a clinical situation such as a patient has recurrent episodes of epistaxis, obtain history. So you have the scenario, you have a patient in front of you and you have to ask relevant questions in 7 minutes. You have to ask all the questions that any doctor would ask, and you have to ask them in the right manner. You have to address the concerns of the patient while asking the questions. You have to act professionally. If the patient has any concerns, you have to address those concerns as well. And the examiner during this history taking session does not typically interfere. They just observe you. If you are going completely off track, they might intervene. And in some stations you have to obtain history and then discuss the differential diagnosis with the examiner. In those stations, after obtaining history, you have to list the probable diagnosis in the order of likelihood. You have to tell the examiner that. So that was video 31. Number 32 was best places in London are free. Now when I visited London in 2023, I noticed that some extremely attractive locations are completely free to visit, such as the parks. The parks in London are typically free to enter. The famous museums of London, such as the Science Museum, the Natural History Museum, British Museum, the Tate Modern Museum, all of these museums are free to enter. You can enter them, you can enjoy them, you can experience that bit of history, you can experience the greenery in the parks in London. All of that is free to enter. And the bridges in London, the famous Tower Bridge, all the famous bridges, monuments, they can be witnessed completely free of charge. I'm not saying all places in London are free to visit. There are some places which require an entry fee, and I've made a video talking about that. Hello Bailey Smith, thank you for joining in. So if you check out my video on the best places in London are free, you will get an idea regarding how you can visit some places which are really fun to visit. Hi, and hello. So one of the interesting places I visited during my visit to London was Sky Garden, and I'm doing good, Haley. I hope you're doing well as well. Sky Garden is a place where you can get a view of the London skyline from the walkie-talkie tower. I believe it is called the walkie-talkie tower because it looks like a walkie-talkie. The only thing is that for Sky Garden you need to book the slot 2 to 3 weeks in advance. It is completely free to enter, but you have to book the slot 3 weeks in advance. You get a magnificent view completely free of charge. So that was the best thing about Sky Garden, the fact that it was free of charge, but you need to do your own research and you need to visit these places by booking the tickets 3 weeks in advance. So in that video, I suggested that some of the best places in London are completely free to visit, such as the parks, the museums, and Sky Garden. In my 33rd video, which was uploaded on 14th February, I talked about informed consent. Yes, sure, you can ask a question. So, informed consent is something you wanted to. So, what is informed consent? Informed consent, I have to. Okay, so informed consent is something which is very important. You have to obtain informed consent before you perform surgical procedures. Okay, so that is an important thing. If you are performing a surgical procedure, you need to obtain informed consent. What is informed consent? Informed consent is when you explain the disease to the patient, you explain the treatment option, you explain the surgery, the steps of the surgery, the type of anesthesia, the alternatives to surgical treatment, the post-operative care, everything needs, the potential complications, of course. All of this needs to be explained in a slow and deliberate manner so that the patient understands what treatment you are offering, and at all times the patient reserves the right to refuse treatment. So, informed consent is something that is monitored, it is tested in MRCS ENT-OSCE. You might be given a task of obtain informed consent for mastoidectomy. So, in that case, we have to explain why mastoidectomy is required, what will be done during mastoidectomy, what kind of anesthesia is typically required for mastoidectomy, when is the patient discharged after mastoidectomy, what are the potential complications of mastoidectomy, what benefits you are aiming to provide by performing mastoidectomy, and you also have to talk about the alternatives to treatment and also post-operative care. So, all of this is discussed in the video on informed consent, broadly speaking the broad points without any specific examples. So, that was video number 33. Now, I will just pause the video for some time. Yes, so I am back. I hope you are still with me. Yes. So, my video on the 33rd video was on informed consent. Video number 34 was on explanation. Explanation is another clinical communication that you may need to have, or that there are various clinical communication stations during MRCS ENT-OSCE. One is obtaining history, another one is informed consent, another one is explanation, where you have to explain a certain disease to a patient, and you may also have to explain the kind of treatment you are offering for the disease. So, the explanation has to be accurate, but it also has to be in a language that the patient can easily understand. So, you have to avoid medical terminology, you have to avoid medical jargon, you have to use simple language but accurate language to explain exactly what the disease is, what are the precautions that the patient should observe, what are the treatment options, whether the treatment is medical or surgical. This is what is expected when you are asked to explain a certain clinical scenario to a patient, such as a patient has been diagnosed with benign paroxysmal positional vertigo. So, you have to explain what the disease is and the treatment options as well. So, this was something I described without getting into details in my video on explanation. This was uploaded on 14th February 2024. On the same day, I also uploaded a video called Breaking Bad News, and it is a very interesting phenomena during MRCS ENT-OSCE. Breaking bad news and explanation, these are kind of very easy to mix up, because the instruction to the examinee or the instruction to the candidate is always explain the plan of management to the patient or explain the disease to the patient. Now, the instruction is always explained, but in some cases it is just explanation, and in some other cases it is breaking bad news. When is it breaking bad news and when is it explanation depends on two things: whether the news is particularly bad or not. For example, benign paroxysmal positional vertigo cannot be bad news, because it is not a very life-threatening disease. Similarly, something like cholesteatoma can both be bad news and can be explanation. Because cholesteatoma, if the patient is finding out for the first time, then it is bad news. If it is something patient is already aware of and is only there to understand what is the treatment, then it is explanation. So whether a particular task is explanation or breaking bad news depends on how bad the news is and whether the patient is already aware of the news or not. If the news is bad and the patient is not aware of it, then it becomes breaking bad news, because you are the first person breaking the news to the patient and the news is bad. But if the patient is already aware of it, even if it is a very bad news, such as maybe voice rehabilitation after total laryngectomy, which is a bad situation, but the patient is already aware that the patient has cancer and requires total laryngectomy, and the patient is already there to understand the various voice rehabilitation options. In that case, it doesn't become a breaking bad news, it becomes an explanation station. So these distinctions, these attributes were described in the video on breaking bad news. Also in breaking bad news, there is a stepwise manner in which you can approach it, such as you have to first ensure that you are discussing the news in a proper setting, that is in a quiet room where the patient is comfortably seated, where you have assured the patient will not be interrupted during the entire discussion, where a specialist nurse is present when appropriate, when you have understood what the patient knows about the condition, when you have asked the patient if they want to know about the news right then and there or not, then you share the news in simple language without any ambiguity, and you check for understanding while you are sharing the news. You wait for the reaction of the patient, and you react with appropriate emotions to the reaction of the patient, and at the end of the entire discussion, you are able to provide a structured plan. You are able to summarize the entire discussion and discuss what is the plan of treatment going forwards. So this is how you approach breaking bad news for MRCS ENT OSCE, and to be really honest, this is how you should approach breaking bad news to patients in day-to-day clinical practice as well. So that was video number 35. Video number 36 was a video which is particularly special to me because it is titled Prepare to Travel. It is something which I felt most people didn't understand, but what I meant by prepare to travel is essentially neither prepare nor travel. It means that if you really prepare well, then a time will come when you would have exhausted all the options in your home country and you might have to take an exam in a different country which involves traveling. And this is something which we had been made aware of during our time as MBBS students, because we had a very nice teacher who used to talk about the fact that if you want to have a very eventful life, or if you want to travel a lot, then the best way to do that, or the easiest way to do that, is to focus on your academics, focus on studying, and you will definitely find that the doors of the world have opened to you. So in Prepare to Travel, I talk about how preparing for exams ends up in creating a situation where you have to figure out how to travel internationally as well, which is what happened with me. Because when I appeared in MRCS Part A, I just had to travel to Kolkata, and at that stage I did not know whether I will pass MRCS Part A or not. When I passed MRCS Part A, I didn't even have a passport. So I passed MRCS Part A. I found out that for the second part I would have to travel either to Dublin or to Glasgow or to Edinburgh or to London. The only thing all these places had in common was that it was outside India and it required a passport, among other commonalities also, but this was the one common thing that really jumped out at me. So I applied for a passport, I got a passport, then I applied for a United Kingdom visa, and then I subsequently made my first international trip to Glasgow to appear in MRCS ENT OSCE. And believe me, a part of me had to figure out everything about the exam to ensure I passed the exam. And not only was this my first trip outside India, it was also a trip that I embarked upon completely alone. So it was a nerve-wracking affair. So this is something where in this video I tried to impress upon my viewers that if you are serious about MRCS ENT, And if you are not familiar with international travel, you have to familiarize yourself with both preparing for the exam, negotiating international travel. So that was video number 36. Video number 37, I hope I'm audible by the way. Video number 37 was marked the beginning of a very popular series called Practice with Puspen. In Practice with Puspen, I uploaded my practice sessions with Dr. Pritha Ghosh. The first video was about history taking, where the clinical scenario was difficulty smell dysfunction. And it is very important, if you want to pass MRCSE NT OSCE, you need to have somebody who practices regularly with you the communication skill stations. Because if you just memorize the communication skill stations, or you practice in front of a mirror without a patient, without a practice partner, that is the perfect recipe for disaster. Most people who have not succeeded in MRCSE NT OSCE have pointed out the absence of a practice partner as the single most important reason. In fact, when I appeared in MRCSE NT OSCE, I was also very worried that I did not have a practice partner who I could practice live with. Everyone I practiced with, I practiced either by Zoom. I always practiced with a screen in between, so there was always a lag. But ideally, you should be able to practice with someone who is in the same room with you, just like the exam scenario. So what I tried to address by starting Practice with Puspen is how you should practice, and preferably you should practice with someone who is also appearing in the exam with you, and even more preferable would be practicing in person as opposed to practicing virtually. So I started Practice with Puspen on 16th February. On the same date, I also uploaded a video predicting the venue of MRCSE NT OSCE. Now, it is very easy to predict the venue of MRCSE NT OSCE because the venue is selected by rotation. So, if like in May of 2024, manned exam happened in Dublin, the next likely venue is going to be Glasgow. After Glasgow, the next venue would be London, and after London, the next venue would be Edinburgh, and the cycle keeps repeating. So if you are aware of this cycle, you can predict the venue of the manned exam of MRCSE NT OSCE even years into the future. So that is something I illustrated in the video titled Predicting the Venue of MRCSE NT OSCE. In my 39th video, I talked about London Revisited. This is basically a video where I talked about the various stadiums I visited in London. As I had mentioned earlier, when I went to London, I had thought of dividing my sightseeing trips into various locations, and largely they were broken. I thought of the different places as either being stadiums or palaces or parks or markets or museums. So all the places I visited in London were either palaces or parks or museums or markets or stadiums. So in the London Revisited video, I talked about all the stadiums I visited, and I visited some of the most magnificent stadiums in London, such as Wembley Stadium, Lord's Cricket Ground, All England Lawn Tennis and Croquet Club in Wimbledon, Chelsea, Stamford Bridge, Arsenal's home ground, Emirates Stadium, Tottenham Hotspur Stadium. So all those stadiums, my visits to all those stadiums were described in the video titled London Revisited. On 18th February, I uploaded the second Practice with Puspen video. Here I talked about breaking bad news. In this case, the scenario was a patient with epistaxis who is bleeding so much that the patient has gone into shock and now requires to be moved to the operating room to control the bleeding, but the patient's condition is so bad that there is a high possibility that he will not make it. This is a particularly difficult breaking bad news station, and it was practiced with Dr. Pritha Ghosh, and that video is there on my YouTube channel. Please feel free to check it out. The 41st video, again uploaded on the same date, 18th February, was on Glasgow. Glasgow marked the first place I visited outside India, if I ignored Dubai, where the layover happened, but I just stayed inside Dubai airport. Glasgow is the first place I visited outside India, and I visited Glasgow because that was the venue of the manned exam for MRCS ENT OSCE. Although I also took the non-manned exam in Glasgow because the gap between the non-manned and manned exam was only 48 hours. So I spent a week in Glasgow for the manned exam, and I got an opportunity to visit a few places, but most importantly, I love the fact that in Glasgow, despite it being sunny in the month of May, it was chilly. I can still feel the shivers in my rib cage when I think about Glasgow. And this was May 2000. There was weather in May. People were walking around in shorts, but I was feeling the chills. I don't know if it was the nervousness of the exam, but it's a fun place, Glasgow. People are extremely friendly there. I remember the sun would rise around 6 a.m. and it would set around 10 p.m. It was a magnificent experience in Glasgow. On 19th February, I uploaded a video on FRCS. Now, FRCS, many people don't know, or some people have asked me regarding the difference between MRCS and FRCS. Easy way to understand this: MRCS is a postgraduate qualification. It allows you to enter the specialist training pathway in the United Kingdom, and FRCS is the exam you can take at the end of your specialist training pathway of 6 years. So FRCS is the exit exam. Once you pass FRCS, you become a consultant in the United Kingdom. So MRCS is the entry exam and FRCS is the exit exam, after which you become a consultant. Basically, it's the ultimate exam for any specialist in the UK, especially FRCS. The name itself contains surgery, so surgical specialists. It is the final exam for surgical specialists, and I've talked about it in great detail in the video. And I've also mentioned the one aspect of FRCS where you can obtain the post-nominals without having to appear in the FRCS exam just after working for a year in the UK after securing MRCS. My 43rd video was titled MRCS ENT OSCE, the other things. Now, in this video, I talked about the fact that the only thing that people focus on when they think about MRCS ENT is the exam. They don't think about the fact that there is travel involved, there is so many logistical aspects of it. Where do you stay, who do you go with, what do you do after the exam, and people also don't think about the long-term plans, like do you really want to work in the UK? Are there any negative aspects of working in the UK? So those points have been highlighted in the video on MRCS ENT OSCE, the other things, and the inspiration for that video was largely watching the movie Donkey featuring Shah Rukh Khan, where people go to the UK with high hopes and they find out something completely different when they reach the UK. So that was the inspiration for the video titled MRCS ENT OSCE, the other things. After that, I uploaded Money Matters because I did face a lot of trouble regarding financial issues, especially when I was preparing to go to Glasgow, because of course Indian rupees is not accepted in Glasgow, and I did not have a credit card at that time. I needed a forex card, which was its own story. I had to go to HDFC Bank, get a forex card, and all of that entire process has been described in great detail in the video Money Matters. And it's very important for you to remember that if you are going to the United Kingdom, the currency accepted there is British pounds. It is not the euro, it is not the American dollar. It is not the job of the bank official to know what currency is accepted in which part of the world. It is your job to know that. If you are going to Ireland, then it is the euro, because Ireland is not a part of the UK. So these are some facts that I have highlighted in the video titled Money Matters. The 45th video was another practice with Puspen video, where I talked about history taking in sudden SNHL. Now, again, sudden SNHL is a very important condition, because if you take the right history, you can come to the right diagnosis, and if you are dealing with a situation like that, if you start treatment quick enough, you can restore full hearing, lose hearing in ear. So it's important that the correct history is obtained in a situation like that. So again, what kind of history should you take in a patient with sudden SNHL, sudden sensory neural hearing loss? That is something which I talked about with Dr. Pritha Ghosh in, in that video. So after that, on my 46th video, which was uploaded on 1st March 2024, it till date is the most video that I have ever uploaded on YouTube. This is titled MRCS after MBBS. Now this is a particularly interesting topic. I had not thought about MRCS after MBBS. I appeared in MRCS after completing MS-ENT, and that too 3 years after completing MS-ENT. However, I noticed that there is significant interest in MRCS after MBBS, and I don't want to speculate why there is interest. I just want to say that yes, people who have completed MBBS are eligible for MRCS, and it is an option that is not completely outlandish. So if you in the video MRCS after MBBS, I illustrated how to approach MRCS with just an MBBS degree. If you are trying to approach MRCS ENT after MBBS, my advice would be take coaching for MRCS Part A, preferably Dr. Sala. Again, I don't stand to gain financially if you take coaching from Dr. Sala. So for MRCS Part A, take Dr. Sala's coaching, and for MRCS ENT OSCE, you can take Dr. Osama Salim's coaching. Again, full disclosure, I have no financial dealings with them. If you take the course, you will benefit, I will not. And I recommend them because most people I know have benefited immensely by taking these courses. I had taken Dr. Osama's course, and it was a very, very nice experience. It made passing MRCS ENT OSCE a cakewalk, and I'm not exaggerating here. So the next video that I had uploaded after this was the perfect preparation plan for MRCS Part A to secure 80%. Now, right on cue, I uploaded this video with Dr. Pritha Ghosh, who shared her experience of taking Dr. Sala's MRCS Part A coaching, and Dr. Pritha Ghosh had secured 80% in her MRCS Part A exam. I had secured only 70%, and I had no coaching, but she had coaching which really helped her, as in her own words, and she got 80%. So if you are busy, if you don't know where to start, then maybe MRC Sala or Dr. Sala's MRCS Part A course can be an option you can consider. So after that, the next video I uploaded was again a practice with Puspen video. This time it talked about a child with profound unilateral sensory neural hearing loss, and this was the breaking bad news station. Why is this bad news? Because a child has completely lost hearing in one ear. Now this can be particularly distressing for the patient as well as for the parents of the patient. So a very normal question that people ask in this situation is, will cochlear implant help or not? Now cochlear implant, depending upon the cause of the SNHL, can help. SNHL means sensory neural hearing loss. Depending upon what is the cause of the sensory neural hearing loss, cochlear implant can help, even if it is unilateral. However, in the UK, the NHS does not fund cochlear implant for unilateral SNHL. So whenever this question comes up during MRCS ENT OSCE, you have to answer it very simply. The NHS does not fund unilateral cochlear implant in unilateral SNHL. Parents might ask, can you offer cochlear implant for this condition? The simple answer is NHS does not fund cochlear implant for cases of unilateral sensory neural hearing loss. That's all you need to say. So I have highlighted that in that video. 49th video was again a practice with Puspen video. This was obtaining informed consent for submandibular sil adenectomy. Now, because we are in ENT, sometimes we tend to forget that head and neck region is also within our domain, and an operation like removal of the submandibular salivary gland is routinely performed by ENT surgeons. So when you are how to obtain informed consent for this particular surgery, this is what I discussed in the video. Basically, you have to remember not to injure three nerves: lingual nerve, hypoglossal nerve, and marginal mandibular nerve. You have to highlight what are the potential complications and how you intend to prevent them from happening. A very important thing to remember while obtaining informed consent is you don't have any compulsion to convince the patient to go ahead with the surgery. Even if the patient refuses to give consent, it is acceptable. What is not acceptable is you not disclosing everything about the surgery to the patient. What do you have to disclose? You have to disclose the disease, the relevant anatomy, the steps of the surgery including type of anesthesia, the benefits you are trying to provide, the complications that may happen, the alternative to surgical treatment, the post-operative care including the duration of stay in the hospital. All of these things need to be emphasized, and you have to always remind the patient that they have the right to refuse to give consent, and they also have the right to obtain a second opinion. You can also arrange the second opinion for them. So this is how you obtain informed consent. The 50th video was how to get GMC registration easily. This was uploaded on 9th March 2024, and my experience of getting GMC registration, that is registration with the General Medical Council, was quite seamless. It is not seamless for everyone. Everybody has their own unique circumstances and unique work experience. So I have described the various documents that are required to obtain GMC registration. I got GMC registration only about 48 hours to 72 hours after applying for it. Some people have had to wait for a much longer duration. So the entire step-by-step process of applying for GMC registration was described in the video titled How to Obtain GMC Registration Easily. After that, on 10th March, I uploaded a video describing my trip to Glasgow. I described the various places I visited in Glasgow. I remember visiting Kelvin Grove Park, which is a very, very pretty park. I remember walking to Glasgow University and coming across some amazing stores and some amazing people in Glasgow. And I've described that in my video on titled My Trip to Glasgow. On 13th March, I uploaded the 6th episode of Practice with Puspen. Here I discussed how to give explanation for benign paroxysmal positional vertigo, where basically you have to describe the disease, you have to describe the symptoms, you have to describe how you are going to treat the disease and what precautions one should observe. It's a fairly common question, and one should know how to explain it in simple terms without compromising on the accuracy, and certainly being aware of the fact that you have to finish explaining the disease in 7 minutes. At all times, you have to be very sensitive about the response of the patient. You can't be in a rush to finish delivering all the information. You have to react appropriately to the patient's emotions as well. So on 7th March, I uploaded the 5th episode. Now the 7th episode. This was Breaking Bad News. This is a very interesting station, anosmia in a chef. Now, if a chef is unable to smell, they are likely to lose their livelihood. So this particularly becomes a very bad news for a very experienced chef who may have thought that they would not have to work in any other profession ever. So if they lose their sense of smell permanently, which is often the case because it's very difficult to restore the sense of smell depending upon the cause, it becomes a particularly difficult conversation. So this was practiced in the video I uploaded on 13th March. This was titled Practice with Pushpen, episode 7, anosmia in a chef. After that, I described the fastest way to reach United Kingdom by the MRCS ENT route. This is very different from the route I followed because I was learning how it goes. But if you are about to start the journey, I would say first thing you need to do is verify your MBBS degree certificate by EPIC. Do that right away, because once you verify your document by EPIC, it stays verified for the rest of your life, and it is one of the most time consuming aspects of the process. You might think you have to spend so many dollars to get it verified, but you have to spend it anyway. If you want to go to the UK by the MRCS route, you cannot skip verification of documents, and verification of documents takes up the most time. So you have to devote 6 to depending upon your preparation status, how busy you are, you may have to devote up to 6 months to prepare for MRCS Part A, then about 3 months for MRCS ENT OSCE. EPIC verification typically takes 1 month. uh, English language proficiency test typically takes another 1 month from preparation to getting the results declared, and then GMC registration is a very short process. So 6-3, I believe in 12 to 13 months you can complete the entire process of thinking about MRCS, finally committing to MRCS Part 1 and getting GMC registration. The entire process can be completed in about a year if you follow the route that I have described in the video titled Fastest Way to Reach UK by the MRCS ENT Route. After that, the 55th video was the first video where I showed my face, and in this video I talked about Welcome to UK. Welcome to UK is basically an online, you can call it a Zoom call, you can call it a webinar, where the people from GMC were kind enough to explain to us the various challenges that people do encounter when they make the transition from another country to the United Kingdom, the various differences that people have pointed out, and they were kind enough to state without any ambiguity that they are not claiming their healthcare system, the NHS, is better than any other healthcare system. They are just acknowledging that it is different and it has certain differences from some other parts of the world. How to adjust the differences, that was the purpose of Welcome to UK, and it had some amazing clinical scenarios. I'll just talk about one here. Suppose there are a group of old people in a nursing home and one particular person is singing very loudly. How do you deal with that situation? Do you use medicines? Do you use any other methods? So it was tackled very, what is the appropriate reaction was discussed very nicely in that webinar, among other clinical scenarios as well. On 22nd March, I uploaded a video titled Success Story, talking about Dr. Pooja Chatterjee's success in MRCS ENT. Now, it is one thing to succeed yourself, but if you can contribute positively to somebody else's success, it really feels very good. And Dr. Pooja Chatterjee had reached out to me, and she had asked me a few questions. It's not like she would not have passed without my contribution, but I did contribute a tiny bit. We did practice a few times, and I was very happy to find out that she had passed MRCS ENT OSCE in her first attempt. So I uploaded a video talking about that. The 57th video that I uploaded talked about how to obtain informed consent for mastectomy. This was episode 10 of Practice with Puspen. This is probably the most viewed Practice with Puspen episode, and in this video we talked about how to obtain informed consent for mastectomy, the steps of mastectomy, the potential complications of mastectomy, the benefits we aim to provide, the post-operative care after mastectomy, the alternatives to mastectomy, everything that. So the template remains the same regardless of what surgery it is. It's just that you need to know what the individual complications are, what the individual steps are. On 25th March, I started a new series called Frequently Asked Questions in MSc-ENT, because I felt that theory questions are particularly are notorious for their complexity, and the fact that people have to answer, postgraduate students have to answer 10 questions, each carrying 10 marks in 3 hours, is quite challenging, and they have to solve the previous year questions. Even if you choose to solve 5 years, then each year has 40 questions. 5 into 40 is 200. That's a big challenge. So I tried to simplify the process by uploading answers that I prepared, which by no means were the best answers for the given question, but it would provide a foundation of sorts upon which people could build an answer of their own. So I started with type 1 thyroplasty. This was uploaded on 25th March, and on 26th March I talked about the explain why sections of MBBS ENT question papers, because I felt that the explain why questions were not answered properly by MBBS ENT students. Now, while we are living in the information age where we are always bombarded with information, I am currently bombarding you with information. It's very easy to get information, but it is sometimes, I feel, difficult to think and analyze. So the explain why questions require analysis, and if you don't know the answer, I feel even if you don't know the answer, if you know the anatomy, you can work the answer out. So I tried to provide answers to difficult explain why questions, what I felt were difficult explain why questions, and it is probably the one of the top 5 watched videos on my channel. After that, on 27th March, I uploaded the another video on informed consent. This time it was total thyroidectomy. Again, the same principle. What are the steps? What are the complications? What are the benefits? What are the alternatives? What is the post-op care? All of that needs to be explained. Then on 28th March, I uploaded a video explaining how to book the MRCS Part A online, because this might be slightly challenging for people, especially when it involves spending so much money. MRCS Part A, the last time I had checked, cost £600. So how do you book it? You have to go onto the official website of one of the 4 Royal Colleges of Surgeons, either the one in London or the one in Glasgow or the one in Edinburgh or the one in Dublin. Go on their official website, follow the instructions, pay the sum, and you can book the exam. When I had booked the exam, I could not book the exam venue at that time. Exam venue was booked at a later stage at no additional cost. But you have to be very aware of when the exam venue booking window opens, because immediately when the exam venue booking window opens, you should book the venue of your choice, because it's very difficult to get a venue of your choice, and you don't want to have the added hassle of traveling a long distance to reach the exam venue. You just want the hassle of appearing in a difficult exam. You don't want to add to the difficulty of the exam by also including the hassle of having to travel far away. So be very careful about that. After that, I uploaded, which video did I upload after that? Okay, so then on 29th March, I talked about English language. In this video, I highlighted the fact that if you want to work as a doctor in the UK, you have to demonstrate to the authorities in the UK that you are proficient in the use of the English language. If you want to work as a doctor, then you have to get registration with the General Medical Council. General Medical Council accepts 2 English language tests as appropriate criteria to understand whether you are proficient in English or not. One is IELTS and the other is occupational English test. On 30th March, I talked about perhaps the most memorable location I visited in London. This is the Greenwich Prime Meridian, or the 0-degree longitudinal line, and it basically separates the world into the Eastern Hemisphere and the Western Hemisphere, and it was a very nice experience. A very friendly tourist clicked a picture of me with one foot of mine in the Eastern Hemisphere and the other foot in the Western Hemisphere. And to be really honest, that is the state of affairs even now. Half of me is in the Western Hemisphere and the other half is in the Eastern Hemisphere. On 31st March, I talked about the transition to the UK, and I talked about what the entire process is like, how to apply for jobs, and once you are registered in the GMC, a long wait period starts, because getting the first job in the NHS requires a lot of patience. Typically, you have to wait for about 7 months from the date you start applying to the date you get your first job. So I talked about that on 31st March. On 1st April, I talked about auditory brainstem implant from the point of view of an MSc theory question. Auditory brainstem implant is when the problem is in the auditory nerve. It is not as efficient a solution to the hearing issues as cochlear implant, but it was a very interesting video. So if you want to know more about auditory brainstem implants, you can check that video out. On 2nd April, I talked about more explain why questions from the point of view of MBBS ENT students. These videos were particularly popular at that time because the MBBS ENT professional exams were around the corner, and they received a lot of views. Just a second, on 3rd April, now by this time I had figured out a system of uploading videos at least once every day. So on 3rd April, I uploaded a video where I explained otosclerosis. Now, as it turned out, otosclerosis was a question in the theory exam of MBBS ENT, and otosclerosis is also a very frequently asked question in MRCS ENT OSCE. So 3rd April, I talked about otosclerosis, what the disease is, what are the treatment options, and you can check that video out. On 4th April, I talked about the preparation strategy if you are somebody who is preparing for MRCS just after MBBS. It was it was a very nice video, so you can check it out if you are thinking about MRCS just after MBBS. On 5th April, I talked about how to prepare for OET speaking. Now, for OET speaking, in one line, I would advise the best way to prepare for it is relax. It is not a difficult part of the OET process at all. You are given a task to talk about certain things. What exactly you need to talk about is available to you. You can constantly refer back to that card, and basically you have to talk in a normal, unhurried manner. You have to be fluent as well as you have to be easily understood by the person you are talking to. On 6th April, I uploaded a video talking about a place that every Indian should visit in London. This is, of course, the Crown Jewel store, which is possible if you go to the Tower of London. You have to buy a ticket for this, and usually the Crown Jewel store is included in the ticket. You can get a glimpse of the Kohinoor diamond, which is, of course, a majestic sight. On 7th April, I talked about how to apply for jobs in the NHS. I basically described a process where I was applying for a job in the NHS, and there are two websites that I have been following. One is NHS Jobs and another is Track Jobs, TRAC. So you get a list of ENT vacancies there. I am an ENT specialist, so whenever a vacancy opens up, I apply, and how you apply is what I described in that video. On 8th April, I talked about orbital complications of endoscopic sinus surgery. Orbital complications of endoscopic sinus surgery from the point of view of an MS ENT theory question. Now, this is something which I felt everybody should be aware of, especially in ENT, because endoscopic sinus surgery is one of the most common surgeries. So, not just from exam point of view, from the point of view of post-op care also, as well as intraoperative attention to detail. You are not supposed to injure the orbit if you are performing endoscopic sinus surgery, but injuries can happen. How do you identify the telltale signs during post-operative rounds, and also how to answer the questions from an MS ENT point of view? That was covered in this particular video. On 9th April, I uploaded part 3 of Explain Why. This was not viewed as much as the other parts because by that time MBBS ENT exam had already taken place, but I still wanted to talk about a few more questions which I felt required further discussion. On 10th April, I uploaded a video where I talked about 3 clinical scenarios in practice with Puspen. One was cholesteatoma breaking bad news, another one was explaining benign paroxysmal positional vertigo, and another one was explaining unilateral severe sensory neural hearing loss in adults. I practiced 3 in a row because in your MRCS ENT OSCE you will get that. You will have one after another stations. You will not get much of a break. So you need to be able to practice multiple stations without a break. If you do that, if you get into the habit of practicing multiple stations without a significant break between each station, then you'll be ready for the manned exam of MRCS ENT OSCE. Okay, on 11th April, I talked about can children give consent for surgery. So in the UK, if a child, so I'm having a bit of trouble with the internet. So in the UK, if a child is believed to have the necessary maturity to understand what a surgery is and what are the potential complications, then a child can give consent for a surgery. This is called Gillick competence, and I talked about that in detail in the video titled Can Children Give Consent for Surgery. On 12th April, I talked about how to practice OET reading part A. Reading part A, I feel, is a very difficult part of OET because it requires you to read very quickly and answer very quickly. You have to answer, if I am not wrong, 20 questions in 15 minutes. So, I described the approach to OET reading part A on 12th April. On 13th April, I mentioned that Tower Bridge is not London Bridge. This is something which many people get confused by. Tower Bridge is the more good looking fancy bridge. London Bridge is also very popular and famous historically, but it is not as fancy looking as Tower Bridge. On 14th April, I made a very nice video, if I may say so, about my own video on Swades, Donkey and the eternal conflict between expectations and reality. So, in both Swades and Donkey, Shah Rukh Khan plays a role where he understands how India is better than some other places, or his presence in India is makes more sense than his presence in some other country. So, this is something which I have also been grappling with, especially I believe everyone who leaves India and goes to another country thinks about India a lot. So, in this video I reflected upon such mutually contradictory thoughts. On 15th April, I talked about sinonasal tumors from the point of view of a theory answer for postgraduate ENT students. Basically, sinonasal tumors is a very long list. If you can think of a tumor, it probably happens in the sinonasal area, and I talked about that as a theory answer. On 16th April, I think I made one of my most researched videos, and I worked hardest for this. This was a video on the old regulations versus new regulations in the practical exams. This was not as viewed as I had hoped it to be, but I highlighted the differences that exist now. When I had appeared in the practical exams, I only had to deal with instruments, radiology, viva, long case, short case. Now there are other things that MBBS students have to deal with, such as OSCE, OSPE and 8Com, and I have talked about them in detail in that video. Next up, on 17th April, I uploaded a history video, a practice with Puspen video, where history taking for a case of recurrent epistaxis was pointed out. History in epistaxis, especially in recurrent epistaxis, is very important because it gives you clues regarding what is the cause of the epistaxis, that is bleeding from nose. On 18th April, I talked about the chronological appearance of the Royal College of Surgeons. Which Royal College of Surgeons was founded first? The oldest one is in Edinburgh. I believe the second oldest one is in Glasgow, the third one is in Dublin, and the one in London is the youngest Royal College of Surgeons. On 19th April, I solved a reading part A sample question paper. On 20th April, I described my trip to the Royal College of Surgeons of England to get this diploma that you can see here, this diploma. So, I had travelled to London and of course to the Royal College of Surgeons to get the diploma. I described my visit there in that video. On 21st April, I made a video talking about the career in UK for an ENT surgeon and a career in India for an ENT surgeon. So, it's a hypothetical scenario. If I were, what happens to a person who leaves his career in India and goes to the UK versus somebody who does not go to the UK? How do their careers progress? It is a hypothetical video where I feel I was able to talk about what can happen, and nobody really knows what will happen, but you can always speculate about the possibilities. On 22nd April, I talked about rhinoplasty. This is by far the most watched MSc ENT theory answer video that I have made, and the various aspects of rhinoplasty that are commonly asked. Rhinoplasty is a very frequently asked question in postgraduate ENT exams, and I talked about that in that video on 22nd April. This was my 86th video on YouTube. My 87th video talked about how Rinne's test is unique, as in, if Rinne is positive in a clinical examination, if you perform a clinical examination and the test result comes back to be positive, it usually indicates the presence of a disease. However, in Rinne's test positive can indicate the absence of a disease. And I did ask in that video, Can you think of any other clinical tests where a positive result indicates the absence of a disease? And nobody was able to answer that to my satisfaction. But there are several other tuning fork tests, just like Rinne's test, which also, if they turn out to be positive, may indicate the absence of a disease. My 88th video, uploaded on 24th April, talked about how to obtain informed consent. Again, I don't want to repeat the subheadings again, how the steps of the surgery, the benefits, the risks, the complications, the post-operative care, and why you are performing tympanoplasty, why you are performing a surgery, if there are any alternatives, what is the nature of the disease, what is the relevant anatomy, all of that needs to be described. On 25th April, I talked about branchial sinuses, branchial arches, and I talked about how human beings have gills. Basically, branchial arches resemble gills in the fish. Basically, human embryos live in a largely, for lack of to oversimplify it, human embryos are also living in a kind of a marine environment, just like fish. So, human embryos have these branchial apparatus which resembles gills. So, I talked about branchial apparatus and how it resembles gills, and how the branchial apparatus leads to development of several different parts in the human body. On 27th April, I talked about reading part B and reading part C. Reading part B and reading part C of occupational English test requires deep understanding. It does not test how quickly you can read and understand, it tests how well you can understand. So, I have talked about that on my video in my video that was uploaded on 27th April. Again on 27th April, I uploaded another video talking about St. Paul's Cathedral. St. Paul's Cathedral is a magnificent location in London. Till about the 60s, I believe St. Paul's Cathedral was the tallest building in London, and even today when skyscrapers are built in London, they are built in a manner to not spoil the view of St. Paul's Cathedral. And Princess Diana, of course, was married in St. Paul's Cathedral, and even during the Second World War, when London was bombed in the Blitz, St. Paul's Cathedral was not damaged, or not significantly damaged, is what I am led to believe. On 28th April, I uploaded a video on the most common criticism of the Royal College of Surgeons of England. Now, I have seen this several times in several social media groups, people complaining about how slow the Royal College of Surgeons of England specifically are in replying to concerns or in processing paperwork. And probably this is because the most applications are addressed to the Royal College of Surgeons of England, and to be really honest, from my own experience, I have never had to worry too much about how delayed their communication is, because they have always replied promptly. So, I don't really understand why people complain, but people do complain a lot about how much they have had to wait for replies from the Royal College of Surgeons of England. Myself, I have never had to wait. They have always been very prompt with their replies. On 29th April, I made a video about laser in ENT, again from the point of view of a postgraduate ENT question. Laser in ENT probably is the most frequently asked question, even more frequently asked than rhinoplasty. So, I made a video about that with my answer for lasers in ENT. Funny thing is, although it is very commonly asked, laser in ENT is not widely available in all ENT. It's not widely available everywhere. On 30th April, I talked about Weber's test and the common mistakes people make, such as people have this tendency, when Weber's test gets lateralized to one ear, they automatically assume that if there is sensory neural hearing loss, they assume that the Weber's test is getting lateralized to the normal ear. It is not getting lateralized to the normal ear, it is getting lateralized to the better ear. So, the correct terminology should be used. Weber's test gets lateralized to better ear in sensory neural hearing loss and to the worse ear in conductive hearing loss. It is not the same as getting lateralized to the diseased ear in conductive hearing loss or the normal ear in sensory neural hearing loss. I've explained the difference in that video. On 1st May, I talked about perhaps the most difficult history station, which is recurrent cough and dysphagia. Now, recurrent cough and dysphagia as a history station is particularly challenging. This is something which I talked about in a practice with Puspen video that was released on that was uploaded on 1st May, and please feel free to check that out. On 2nd May, I talked about perhaps the most frequently asked question in MRCS Part A. I believe this was about biliary atresia. This is one of the most frequently asked questions in MRCS Part A. Every aspect of biliary atresia can be asked. On 3rd May, I solved Part A of listening, OET listening Part A. I solved a sample test of OET listening Part A. As previously talked about, listening involves hearing an audio on headphones, and the most important thing is the audio is played only once. So, you have to pay full attention when you are listening to it, because it can't be replayed. So, I described that process by solving a sample test. Now, these sample tests are freely available in the official Occupational English Test website. On 4th May, I talked about how to obtain certificate of good standing for GMC registration. Now, certificate of good standing is something which people do need, and depending upon how many different medical councils you have been registered under in the preceding 5 years, when you apply for GMC registration, you will need that many certificates of good standing. So, if you have been registered with 5 medical councils in the preceding 5 years from the date of your application for registration with the GMC, then you would need 5 certificates of good standing, one each from each medical council you were registered under. For me, I only needed it from one medical council because I have only worked in one state in India. So, I got it quite easily, and I have described the process in that video. It is very important to remember the certificates of good standing are valid for about 2 months, if I am not wrong. So, please do not get the certificate of good standing even at a very early stage, get it at the right time. The 99th video that I had uploaded talked about the best reason to emigrate to the UK as a doctor, and contrary to popular opinion, I feel the best reason to emigrate to the UK as a doctor is the fact that you can treat patients who do not have to pay for the treatment in the NHS. So, in the NHS, patients do not have to pay for surgical procedures, patients do not have to pay for doctor visits. That is a very good system, I feel. So, that is one of the best reasons why people should emigrate to the UK, although NHS has its own problems, which I have highlighted in several videos I have uploaded subsequently. But I do feel that only having to worry about treatment and not having to worry about how patients will financially manage to get themselves treated is a welcome relief. You do not want to get into a financial discussion with patients, something which I personally am quite uncomfortable with. The 100th video that I uploaded on my channel was a postgraduate ENT theory question, which strangely is not available, the answer to which is not available in any ENT textbook that I searched. I found the answer in an anatomy textbook. The question is parasympathetic ganglia in head and neck region. So, I found the answer to it in anatomy textbooks, and these are questions which I do not really understand. If you are asking a question in postgraduate ENT exam, the answer should be there in postgraduate ENT textbooks. I am not criticizing the person asking the question, I am criticizing people who are writing the textbooks. On 7th May, 101st video was uploaded. This was explain why part 4. Again, it was not watched that much, but I wanted to talk about certain difficult explain why questions which I talked about in that video. On 8th May, I talked about a case where there was laryngeal cancer and there was metastasis to the lungs. So, if metastasis to lungs has happened, very few treatment options are there. In fact, mostly palliative care can be offered to the patient, and this is a particularly difficult conversation with the patient. So this conversation was demonstrated in a practice with Pushpen video that was uploaded on my channel on I believe it is 8th May. On 12th May, I solved listening part B sample test. I demonstrated how to solve it. On the same day, I talked about why doctors leave the United Kingdom. So I had made a video before this talking about why doctors go to the UK, and had also talked about, I made another video talking about why doctors leave the UK. So this is a very interesting trend that has been talked about by various people, and there are many videos on YouTube talking about the exodus of skilled people from the UK, and there is also a lot of influx of skilled people to the UK. So why do people leave the UK? They complain, especially doctors. Why do doctors leave the UK? The main complaint is inadequate pay, or pay not matching up to inflation levels. So I talked about that in that video. The 105th video that I made talked about deep neck spaces. Again, this was a theory question. Deep neck spaces is commonly asked in postgraduate ENT exam. I talked about that here. On 14th May, I talked about how to attend the MRCS diploma ceremony and my experience here. Once I was confirmed as a member of the Royal College of Surgeons, there is an official ceremony where you can attend, you can go to London. In my case, I had to go to London because I am a member of the Royal College of Surgeons of England. But to attend the ceremony, you need to confirm your presence, and again, this is time sensitive. So I got an email and I replied to it 12 hours later. When I replied to it 12 hours later, I received a reply stating that no vacancies were available. So I had to get into an email exchange with the Royal College of Surgeons. I requested them to find out a way, and luckily somebody who had expressed a desire to attend the ceremony had withdrawn. So vacancy opened up and I was able to attend the diploma presentation ceremony in person. So the steps that you should follow to attend the diploma presentation ceremony were described in this video. And the 107th video, and the last video I'll talk about because it's already been almost 70 minutes and I don't know how good the quality of this live stream is a video talking about cochlear implants. This is a video where one of my colleagues, Dr. Moinak Moitro, shared his experience of cochlear implants. He has extensive experience in cochlear implants now, and I am very honored that I know him personally. So he talked about cochlear implant surgeries in Kolkata and how revolutionary the intervention really is. Cochlear implant, in my opinion, is not just the best surgery in ENT, it is the best surgery period. So of all the surgeries known to mankind, I believe the best surgery is cochlear implant surgery. So please feel free to check that video out. It is a remarkable video where Dr. Moitro has shared his insight about cochlear implants. I believe I should stop the live stream now, and I'll see you soon in the next one.